We are live. So good morning, good afternoon, good evening, wherever you are, AFWO family. My name is Drea, and I am an administrator of the Air Force Wingman Outreach page. And today is Friday, okay? Happy Friday to everybody. I hope that you are having a good day, a great morning, a great night, whatever it is that you're dealing with today. But I think today is going to be special. But the first thing I want to get out of the way is that Air Force Wingman Outreach at gmail.com is how you can reach us for any type of advice or questions that you want to submit anonymously to the page. And so from there, we go ahead and we post it to the group anonymously, and then all of us rally around each other like we always do in order to answer your questions and help each other. Additionally, if you go to the top of the Facebook page, then you will have the option to go to administrators and scroll down, see any of the admin, click message, and then you can reach out to any of us if you need. But overall, you matter, AFWO. We appreciate you. So today is special, and I love every interview is special. But therapy, oh my goodness. You know what? I know the huge meaning of when they say talk to your therapist. All right. But we also have someone special on. We want to welcome Shannon to the AFWO Speaks podcast. How you doing, Shannon?
I'm doing great. I feel so honored to be here. Thank you for this opportunity.
All right, right on. And the reason that I brought Shannon on is because I think we found ourselves in a Facebook post together in the AFWO group. And then, next thing you know, she was talking about some different types of therapy, and it piqued my interest. And I said, hey, I want to know what you are talking about. And so we've been connecting ever since, and it's been amazing. I'm well informed, and therefore I feel like it's my responsibility to inform the family, the AFWO membership, 39.8 thousand members in our group, about what we got going on. So let's start with you telling the membership about yourself. What's your background?
So, I am an Air Force Airman. I have 28 years in service. I am currently over the Aeromedical Staging Squadron, or the ERPS as it's known now. It's had many names, the CASA, for those that don't know. We're the ground crew to the air crew, and I absolutely love our job. We race in, we pull people off of the airplanes, helicopters, Humvees, whatever they come in on, and then we move them to buses or ambulances, and we take them to get the next level of care. Absolutely love my team.
Awesome.
And I am a mother of four beautiful daughters. I have two grandbabies. I know, crazy. Currently, I'm a single mama. And in my lifetime, I have suffered multiple traumatic incidences throughout, as well as in my military service. And so I too have had to seek therapy and care because I hit a brick wall. I hit to the last point where I had to take a pause and say, I got to take care of me. And so my goal is to help people not get to that point.
Awesome. Well, thank you for sharing that, and shout out to your ERPs and the ASTS crew. I'm sure they're out there doing great things. We appreciate what they do. And also, of course, family is important. The grandbabies, your daughters, all that fun stuff. Family is important too. So shout out to them.
Yes.
So let's get into this conversation about therapy. Okay. So I'll say that, over my time, I'm 35 years old, and pretty much, therapy was not something that was commonly talked about growing up in my household. It was one of those things where it was just, you either suck it up, or, there may be controlling your emotions, or, men don't cry, different things like that. Like it wasn't elevated to the point where it was embraced. And then as an adult, it was kind of like, somebody's like, oh, I'm going to therapy or seeing a psychiatrist. And you're like, ooh, what's going on with you? You're thinking the extremes, right? And it wasn't until I experienced the situation myself where I ended up going to mental health and getting seen and all that, and realizing that it's just like going for a headache or a head cold or any of that. And also, treatment of myself, treatment of my emotions and my brain. So, why do you think that there is something about therapy? Like, I don't know if misconception is it, but it's just something about therapy that tends to make some people uncomfortable. What do you think?
Oh, there's so much, right? So, because we're limited on time, I think I like the word perception, right?
Okay.
Because a misconception means that we misunderstand something, right? Or that's how I see it. Where perception is my brain is telling me, or the environment around me is telling me, well, if I get therapy, I'm weak. Only crazy people go to therapy, right? And like you said, it's not embraced. And then I think it gets even deeper than that, right? Because therapy causes us to be vulnerable because we have to really connect with what's going on with us. And we don't get to project out when you're with a good therapist or a good coach. They're not going to let you project out, well, so it's not my husband that has all the problems, it's me.
Mhm.
And their focus is going to be on you. And then the other part is, I think, as military members, I found in my 28 years of service, there is this big fear that if I seek help, I can't continue to serve. And that's not true. It's like having a broken bone. So, in the case of mental health, we have damaged, we'll say, our brain, right? That doesn't
Mhm.
mean that we're broken, nothing like that. We just suffered a pain, right?
Mhm.
And so, when I talk about pain and I talk about trauma, I'm not necessarily talking the big things. I'm not saying we went to war and we took care of all these wounded patients. Sure, that's an example of trauma, but trauma is the little things in life, or things that maybe people see as the little things. So I'll use me as an example. I went through a divorce. That is trauma that a lot of people don't understand. And so when you go through that, there's a lot of loss and grieving and emotions that you need to go through. So as I went through that, I had to seek therapy. And that therapy was like hurting my feet. I had plantar fasciitis, right? So it's the same thing. I had to go to the doctor, get my foot x rayed. I went to the doctor to talk to them about what was going on with me mentally and emotionally so that I could get better. And that's the goal for all therapy and all with therapists is to get you in, talk you through whatever it is that's going on with you, and to help you heal. And that could take, depending on how long you wait. In my case, I waited for really good therapy for, I'm 49 now, so 3 years ago, like 45, 46 years old before I said I needed help. That's a lot of stuff going on in there, and it's
Mhm.
not going to be overnight that I'm going to get better. And so that's the other thing. Andrea, I apologize, I didn't mention this in there. Therapy is not like a one and done. It can be, but typically it's going to be several sessions, maybe a couple years. Each individual is going to be totally different based on what their life experiences are.
Right. And I think that it depends on our background and how we were
Yes,
raised, and then we go
yes,
into the military and are taught a certain structure which kind
yes,
of may conflict against the way that we were taught. And
yes,
we don't realize these things are happening until maybe years later down the line when
right.
certain traumatic events hit us and we're kind of triggered on certain things, right?
But agree 100% with that. Very
Yeah.
much so.
Yeah,
Hmm.
so I mean, so one thing I didn't know is, what there are like other methods of therapy. Like when I am naive when it comes to that. I'm just like, okay, it's just, what you see on TV. You put somebody on the couch and that's pretty much therapy. Like there is no other way to do it. That's therapy. But you know otherwise. So please
Yes,
share with people
yes.
how many types of therapy are we dealing with here?
So right now, technically speaking, there's 176. However, on the daily, just like with medicine, they come up with new innovative ways. So the hyperbarics chamber they're finding is good for people with PTSD. Now, is the military using that at this point? No, but some VA systems are using that. So therapy, modalities, I just mentioned a few. If you want more, I can reach out to you. I myself, as you have used several and investigated several. So, craniosacral therapy, I actually used for, I was having bladder issues and I was having feet issues. However, it's a form of energy work similar to Reiki. So, that craniosacral therapy not only helped me heal my feet, it helped me heal what was going on with me physically and emotionally. Um, Energy work, I mentioned Reiki. There's multiple types. I'm more familiar with just the Reiki version, and that is where they can put hands on or hands off and move energy throughout your body. And for me, it felt like electrical impulses. And I was very blessed to go to a Wounded Warrior retreat, so to speak. It's called the Warrior Connection. I went there, and that was my first experience with it. And every time I go, I'm releasing something. And what I absolutely love about that is I never really have to connect to what I'm releasing, but it's being naturally released out of my body through the energy work. Brain spotting is another one. That one is where it's similar to EMDR, and they call it advanced EMDR, or they'll say EMDR on speed is the term. So EMDR is eye movement, something desensitization. And so with that one, they typically use a red stick and they bounce it back and forth. And I almost felt like I was getting hypnotized to move it. Well, brain spotting is where you pick a spot on the wall, and then you pick another spot on the wall, and you focus on those two spots to release the traumatic event that's in your body. And they're both very similar in that aspect. They do make you connect. They'll have you talk about the experiences first, and then they make you connect with the emotions of those experiences to help release them. I loved both of them. Brain spotting is exactly what it says it is. It's a great release. Parts therapy, I'm actually doing that one right now because I was in EMDR, and we can't do it. Obviously, I don't get to go in sessions, so it's hard to, move the stick back and forth. So we do parts therapy, and he talks to me about what do you feel in your body? Where do you feel that? And then we work through what that is. And parts therapy is another word to talk about is family therapy, family systems therapy. And that is where you're connecting to those past emotions that are showing up, or as you call them, triggers that are showing up today in whatever situation that you're in. The next one is talk therapy, which is what most of the military, most counselors do. Cognitive behavioral therapy is one. Tapping is one. And I won't go through it, but you're basically tapping parts of your body, and then you're moving down, and then you do that a couple times to control anxiety, to help you get regrounded, maybe to help you go to sleep, whatever, to shut your brain off. It can be used in numerous ways. Deep breathing, I'll combine that with meditation. Just before this interview, we did some deep breathing so that I could connect, because believe it or not, I don't like public speaking. I'd rather do it on a stage than behind a camera. And so I just needed that little bit of deep breathing, a little bit of a meditative prayer state so that I could be real well connected. Art therapy, music and dance therapy, acupuncture. Oh my gosh, the list goes on. So if you want more of those, I'll be glad to connect you. But there's 176 plus. We don't have enough time to list them. Now, what I am going to say is I'm currently working with another person, and we as a team have started challenging the models of therapy that are out there and following new science to hopefully help people from traditional modalities to connect to be better, faster. Maybe that's a good way to say that, but there's nothing. So when you find these quick fixes, let me be very clear. There is nowhere that in most cases there's going to be a quick fix. And then the other part is that because something works for me, it may not work for you. And right now we're challenging, I wrote it down so I could say it better. We're challenging the traditional model of therapy because currently it has a high failure rate in our opinion. And we feel like people need help now. We combine insights and expertise that has been effective for years, and it helps us to understand how our body and brain work on a conscious and subconscious level. And we're trying to combine also the mechanics and the processes because we're a whole human being.
We're a whole human being. That is powerful stuff. And 176 modalities. That is even insane to recognize. But I definitely, the meditation, I've done that. The tapping, I've done that. There's just different ways of therapy that I don't think we give ourselves, open ourselves for options for those. And
Right.
like you said, it may work for me, not work for them, but it's nice to have choices. It's
Yeah.
nice to be able to experiment and see if like, hey, maybe this is for me, maybe it's not for me. So thank you for
So
sharing that.
let me add one more thing. So for
Sure.
me, I used a multidimensional approach or multifaceted approach, however you want to word that. So I
Sure.
did a combination of energy type work, like I said, cranial sacral energy work. I did EMDR and I also did talk therapy. So just to be clear, I want everybody to understand there's not necessarily a wrong or a right way. It's going to be what works for you.
Right on. Whatever works for you, but definitely know that we all have options.
Yes.
So, on that note, what can we do as individuals to really work on improving ourselves emotionally and mentally? In
All
your opinion?
right. Okay. So I'm gonna I'm gonna go here.
Go ahead.
Yeah, everyone walks their own paths, and our paths are very subjective. Just like the life experiences are very subjective and very different, and how we respond to them is going to be different. I can go to a combat zone with someone, and we can go bring 50 patients over the course of our deployment off the flight line. And my cohort is going to go home and have a mild adjustment period and be just fine. I might go home and have that mild adjustment period and then find out 6 months, a year later, hey, I'm not adjusting back.
Mm,
So, because what dictates that a lot of times is what did you experience in your childhood that is now embedded in your brain, that is part of your subconscious, your unconscious, that helps you to react in a way that you're not even connected to or you're not aware of. And then I wrote other notes. So, oh, I think I said it. So I said that already. And
okay.
then you asked, how can they improve themselves?
Yes.
Okay, so I'm going to speak to what has helped me. And
Okay.
so I brought my books out. I told Dre I have like 50 books here. So,
Yeah.
Daily Fire, this is where I get my Bible studies. So, if you're a Christian, this might work for you. If you're not, there's like the Daily Stoic. There's something out there that's going to work for you. But I stay connected spiritually. My spirituality is Christianity. So, my goal is to use my Bible study and prayer. I love prayer.
Mm,
Especially when I'm by myself and I have nobody to connect to. And we'll talk about that down there about your support system, but that's kind of like my support system. I always have that spiritual part of me connected. Prayer
mm,
and meditation, I mentioned. Uh, I go in for regularly scheduled body work, and I'm paying for that now. At first, it was part of my therapy, but my feet are better, my bladder issues are better, so now I have to pay for that. But I'm willing to take the hit for that because for me, it helps me. And so regularly for someone might be once a week, for especially as you're going through the beginning stages of the healing process. For me now, I try to go once every month or once every couple of months, and because it does cost out of my pocket, I have to budget for that. Um, Turn off social media and disconnect. If you have to, just say, hey, I can't be here today. And that may mean even for if you are an administrator of a page, hey, I got to lift this off. If I'm a first sergeant, I got to turn off and I need to advocate either another first sergeant help me in my squadron or my additional duty, right? So
mhm,
sometimes you have to give yourself that disconnection. Take walks, go for a run, go to the gym, whatever works for you. Walks, run, Pilates for me is what I like, and yoga at times. Um, I watch very little TV. At first, when I first started realizing I was having issues, TV would trigger me. It was
mm,
bad. I went to a movie theater, saw a movie, and my mom made note that I shook the whole time. By the way, that was post deployment, and this
right.
movie was a war movie. So it was a huge trigger. So for
Mm,
me, I turned off TV because it was a trigger. Now I keep TV off more so that there's less out there that for me I want to put in my brain, and I'd rather sit and read a book or sit and visit with my family. We play games. What's that game we play? I don't know. You use your phone and you play on the TV. My kids and I play
right
that.
on.
And then that's it. that's it, I think, for the moment. That's what I wrote down.
Yeah, thank
Yeah.
you for sharing. Thank you for sharing that, because we have different ways, but what's great about sharing that stuff is that there are things that people may not have thought about or
Yes.
considered, and therefore say, you know what, maybe that's the case. I know with me, TV is similar with that, as far as I know what my brain is taking in. Like, the content can be so overwhelming and
Yes.
emotionally draining to where your brain is just like, I just cannot do this today. And so what used to feel like a habit that I needed to have, or a
Mhm.
connection that I need to have to the outside world, is now something to where I'm like, keep it out. I don't want any of it. So thank you for sharing that. So moving on to that, and you kind of touched on a little bit. So support systems, I did a episode on that with my own support system, friends and things like that. But what are they important in your opinion, and why?
So I actually, again, I rewrote some of my answer.
Sure, no worries.
Um, so if you go historically back to our own history, right, as human beings, we are tribal in nature. We are built and wired to be connected. And in this day and age, and especially during COVID, we were all forced to disconnect. And with social media, we're making friends, which is great on social media, and we're reaching different platforms, but in the end, we're still alone.
Mm,
And we weren't wired to be alone. So we definitely need a support system. I feel like, okay, so I just reviewed my notes. So for me, I'm a giver. I'll give until I'm completely worn out. I also have some, if you believe in these things, uh, empathic belief system, right? So I'm very empathic, I'm very caring, I'm very giving. That can become very emotionally draining for me.
mm,
So I need people that are going to lift me up, build me up. But it also goes back to that disconnection piece. So it's okay to be disconnected some, but you also need that support system. So I relied on having my builders. I relied on having my daughters help me and be their friends. And when I talk about builders, these are people that are looking at you going, you know what, you're a little bit cranky today, and this is not who you are normally, so you need to take a step back.
mm,
Or I've had
mm.
people do that with me.
Right.
Or just tell me, hey, you've been really quiet for a few days. I'm a little concerned about you. You
Mm,
need those pieces because we all innately want to be cared for and loved. It's how we're made. I feel like most of us, and I feel like in some ways the military does this to us, not in a bad way, but when we go through something, we disconnect. And I think that, like Drea had mentioned, we disconnect based on our family situations, and we disconnect because one, I don't want to be a burden to somebody. I don't want to put my problems on someone else. And then another big issue is, why do I need to be vulnerable? I don't want to be vulnerable. Vulnerable is scary. And I'm afraid if I'm going to be vulnerable, somebody's going to judge me. However, if you've built your life around true friendships and your tribe of people around you, then those people, hopefully, the goal is they won't be judging you, and they'll be lifting you up and building you up and then giving you what you need. And it can be good or bad what they're giving you. And what I mean by that is, if I'm in a cranky mood, I need somebody to say, hey, you're being really cranky.
mm,
And why? What support do you need? And that's the key to being in a support system and
mm,
having a
mm.
tribe.
Yeah,
And you have
true.
a difference, right? I wrote this down, and I apologize, Drea.
No, go
There's a
ahead.
difference between friendships and acquaintances. Acquaintances are people you know, but they're never really going to be honest with you.
Mm.
Friendships, they value and love you, and they're going to be honest with you.
That's a
Yes,
good point. And we need to establish the difference, because we tend to be very trusting, right?
yes,
And so it's kind of like, hey, this person is talking to me. They must want to be my friend, versus, you just know the people that you'll call in a crisis, the people that
yes,
you'll call and say, man, I need to vent, versus the people that are like, okay, well, maybe I'll let you borrow a piece of paper at work or something like that, like little things. So the trust is there with the friendship, right? So
yes.
thank you for mentioning that. Um, I am an empath as well, so I can definitely connect to that. And so, when people share things with me, it's great. But at the same time, I'm very, I hold it like I don't know, I hold it like a coat or something like that. And then I need to take the coat off because
Yes,
I'm getting in my emotions a little bit too much.
yes,
But it's one of those things where going back to some of those therapies or some of those methods is what ultimately brings me down to earth. So
yeah.
I can totally relate.
And
So go
let's
ahead.
stay on tribes. Stay on the tribes for a minute.
Sure, sure.
In our society right now, I think we are very much less connected and don't have tribes. And so I just want to speak for Air Force Wingman Outreach, Air Force Quarantine University, I almost said anniversary university. Those are resources that you should, if you need them, feel comfortable reaching out to. Or if you need a counselor, go to a counselor. You may need that counselor to be part of your tribe. Because again, personality types, right? Introverts, extroverts, and there are people that really just don't have that safe space. So find that safe space. Find someone you can trust by using some of the resources that you have out there.
Absolutely. Air Force Wingman Outreach we consider ourselves a resource because of the ability to bring all of these memberships together to
Right.
where, you just never know the experience that people have. So, yes, I 100% agree. So moving on, what your what are do you have any advice or lessons learned from your experience with mental health that you want to share with the people?
Okay. I'm looking over my notes to see
Sure. No
how much
worries.
of this I want to add. Um, so advice or lessons?
Or
All right,
could be
I got
could
it.
be
I got
you
it.
could okay, go ahead.
Got it. There are numerous therapies out there. If one does not work for you, go back and try something different until it works, right?
Right.
Um, some modalities are going to be more helpful than others. And I believe that in this case, uh, using meditation. So, one of the things that I did do is I found a hobby. For me, a hobby is fishing. And in that fishing, there are quiet times because you're waiting on the fish to bite. And then there's the adrenaline rush, especially when you catch the fish and you reel it in. And so that's a form of meditative therapy for me. So let's say that you're in therapy and you're having a bad week, a bad month, a bad day. Those days don't last. That time doesn't last. You have the ability to come out of that. So just keep getting up and pushing yourself through it. And if you have a support system, be vulnerable and say, hey, today I'm feeling a little depressed. I'm not sure what's going on, but I'd really like you to be my accountability partner. Can you be my accountability partner and check on me and help me out?
Mm, mm,
Um, Try new things, open your mind to other alternatives. So I'll speak to energy work. As a Christian in the Bible, I have been told that doing energy work is not, it doesn't align. And that may be a true belief system for some people, and I don't disregard that at all. But for me, I focus in when I go through these different alternative therapies that are maybe out there a little differently than what I grew up with or what I aligned with. I opened myself up to them, and then I focused in on who my spiritual person was. In this case, it is God, Jesus, whatever word you want to call that. That was where my focus was. It doesn't mean your focus has to be there because you may have a different belief system, right? But I used that. And so for me, it was the way I was able to accept and allow that modality of therapy into my life, which has had huge dividends because I didn't have to go through all the pain and suffering or relive it like some therapies take you through. And I was able to do these releases of this negative energy in my body out into the world. And I did it in a safe way. Um, so Try old things. I said, so what I said is try new, try different options of therapy, even if you have to pay for it, find a way to pay for it. There's nonprofits, tons. I think I Google nonprofits for veterans, right? And I sent a message. I think I said there's over 48,000 nonprofits out there. And then a lot of these nonprofits, if they work for you, like there's that's not coming out, horse therapy, animal therapy. For mine, I went to the Warrior Connection, which offered a lot of art therapy and energy work and all these other things, journaling, things that I didn't understand how to use. I got a quick week of how to use it, and they'll pay for you to go. Or they'll connect with you and give you resources for free. And then I put try old things. So fishing for me was an old thing that I used to do with my dad that I reconnected to, so that I could be in nature more. And then I put, oh, good. Okay, so then I put be with yourself. So one of the things that I have learned over time, be with yourself, love yourself. The same compassion, caring, giving that you give to others, pause and give those things to you. And that might be setting healthy boundaries and saying, hey, today I need a break. I'm going to take a break and I'm going to pass this phone on if you're in a leadership position. If you're a younger airman and you're taking leave, ask your leadership team if, unless it's really an emergency, I really need this downtime. Take that downtime. Take that weekend off. If you're doing it and you're not in a happy place and you're in an unsafe place, go with somebody else. Take them with you. Build that tribe. Go with your tribe, but take that downtime. And sometimes downtime is just sitting and being alone with yourself so that you can connect with who you are and what it is that you need.
Powerful. And I know that there's some members out there that are like, but I need to be doing something, Shannon. I need to be busy. Okay. You're telling me that I have to sit on the couch and just do nothing? That is, I don't know. I don't know. Is it possible? It can be done, right?
Yes. Yes. Well, I'm one of those that's a
Right.
doer and I stay busy. But a lot of times when we're staying busy, and this is not for everybody,
Sure.
but in a lot of cases, especially type A personalities, being busy allows us to really stay disconnected from who we are and what we need, because it's again going back to that vulnerability. If I'm vulnerable, I'm a little bit scary because I'm connected to myself and I might not like what I'm seeing, but it's okay with whatever you're seeing, because you're going to practice that grace, love, and compassion and go, ooh, I'm perfect just the way I am, exactly where I'm at today.
Hey, and you know what? I don't even, it's definitely something that kind of like it feels like it should be normal, but
It's not.
as far as it's not. So, it resonated me with me when you said be with yourself and love yourself exactly as you are in the moment. And I don't think I remember any points in like traumatic experiences or good or bad to step back and say, you know what, Drea, thank you. Thank you for just being the person that you are. It was about receiving that from other people and getting validation versus already having that foundation built within myself. So, AFWO, we need to work on that, if that applies to you.
I work on it daily.
Hey, yes.
It's a not a learned, it's a practiced behavior. Yes.
Yes, ma'am. Absolutely. So let's talk about quotes. Do you have any quotes you want to share with us that resonate with you?
Okay. So I want to share this.
Go ahead.
Because again, this goes back to what works for me and what works for you. So a lot of people live by positive affirmations or quotes, and those are great things. They're great tools and resources. But my fear is when we start living with positive affirmations, let's say you have this positive affirmation on your mirror and it says, I'm going to be happy today. And I look at it every day. I'm going to be happy today. I'm going to be happy today. And well, I'm not happy. I'm pretending I'm happy. I have this smile on my face, but my heart hurts. My mind hurts. My mind is racing, but I'm telling myself I have to be happy. When you have those positive affirmations telling you that, you're now creating a space where you're allowing guilt and shame to come in because I'm telling myself to be happy, but really I'm not happy. So I'm not saying that they're wrong, but for me, they didn't work for me. And quotes, I might find one today that works for what I'm going through today, but tomorrow it may not be any good for me, or it just may not resonate as much. But I have some that I think that would be appropriate for what we're talking about here and talking about our brain, our heart, and our systems. Those things that hurt instruct. Benjamin Franklin. That we wrote through our business Instagram. Your emotions are neither good or bad, right or wrong. Feelings are what they are. They simply exist. Judging your emotions won't help you feel better. Remember that they will pass. When an emotion is strong, it feels like the truth. Just let yourself feel it and allow it, and then let it go.
I felt a little Frozen type of vibe when you said let it go. I was like, oh goodness, we have to feel it and let it go. And I definitely think that is something that is a work in progress. So thank you for sharing that. And after this interview is done, I'm definitely going to make sure to update the post with that quote in case anybody really is interested in using it for their own. So moving on, let's talk about any recommendations you have for podcasts, books, audio books. What are some things that maybe we can read to help us?
For me, I use the Daily Fire. For you, like I said, it might be the Daily Stoic. I think there's something called the Stoic book. I love TED Talks for what's going on with me. There might be a TED Talk out there if I'm going through a divorce. How do I go through a divorce? Something like that. That might resonate with you. Specific therapist that I follow is Dr. Carolyn Leaf. She offers Instagram page, a podcast. I believe she's been on TED Talks, but I've mostly followed her on Instagram and TED, her podcast. And Hey, Dr. Rachel has a podcast, as well as an Instagram page. And then Tim Ferriss. And I wanted to speak very specifically to Tim Ferriss because we're a huge population of males in the military. And what we're finding is males and females. I don't want to isolate anybody, but typically males are less able to be vulnerable. It's very scary for them because they have to man up, right? We've conditioned them to believe to be a real man that you shouldn't be vulnerable, but it's okay to be vulnerable. And what I liked about Tim Ferriss is he does talk about what it's like to go through abuse as a man, and he did suffer sexual trauma. And he does have some out there modalities that maybe aren't conducive with military service, because he does talk about some things that we obviously can't use or tools we can't use. However, I do like that how transparent and vulnerable he is as a male. And so I think that would be good. And then sometimes just stop. And we're going to go back to stop and be with yourself. Find space and just allow the space to be with yourself. So I'll mention this past weekend, I was very blessed. My grandchildren and my 3 daughters of 4 live with me still. And my grandchildren went out for the afternoon of Saturday. I had the house to myself practically. And then Sunday, they went out from like 10 a.m. till 7 or 8 p.m. I took advantage of that quiet space to just be with myself and not necessarily be connected to my phone. I was connected to just being in my house and enjoying the quietness of that space.
But does the house talk back when you're in your quiet space?
I don't know if it's the house or my brain. Yes, my brain
yeah.
talks back sometimes, and I can get in my head, and It can turn, my thoughts can turn into something which might create anxiety, and those four walls may not be good for me. So it might be just leaving those four walls. So yes, can your brain speak to you? Yes, but I would ask you to embrace what it's telling you in those moments. And if you need to, journal, uh, pick up a book and read. I'd encourage you not to I would encourage you to go back to feelings, emotions. They're good for you. They're there to teach you a lesson. Embrace it and love on that emotion, even if it's a bad emotion. It's there to teach you something.
Agreed. So, I ask my guests this all the time about their inspiration to live, because we are a resource. We also talk a lot about mental health, about suicide, different things like that. And it tends to be on some levels that some people may not feel a sense of purpose. And so I wanted you to share what your inspiration was.
Okay, so I might have misunderstood this question. So my inspiration now in this moment, or my inspiration when I was struggling?
No, well, both.
Okay. So I kept pushing forward initially in the beginning because I was afraid I was going to let somebody down. And a lot of times those somebodies were my children or my grandchildren, or very specifically in the beginning, my airmen. Did not want my airmen to see that I was broken, that I was hurting, and that I was in pain. So a lot of times I put this facade on that I was perfect and I smiled all the time. And that was very beneficial at times because my airmen were more open and apt to come to me. And then in the moments that I needed to use my vulnerabilities of what was happening with me when they were having, I don't want to call it crisis, right? When they were struggling, then I was able to use that tool to connect with them. And so I was glad that I had my military service to continue on.
Yeah. Okay.
Because you're not alone.
Yeah,
definitely. I wasn't alone.
Definitely. And although in that situation you felt very, it's easy for your brain to really make you feel like you're isolated, or make you feel like you're stuck in this place. You can't get out. There's nobody that can help you pull you out. So I think that's awesome. And we just need to tap into thinking, embracing the feeling, but also acknowledging reality too, like what's around you, who's in your life, maybe reaching out for help. So we have reached pretty much the end of the interview. And what I normally ask my guests is if they have any advice, any message, any words for the Air Force Women Outreach membership. And it's not, nobody's expecting anything, it's not a script or any of that, but sometimes, some people want to hear things that are relatable from people about stuff. So do you have something for our membership?
Oh, yeah, I remember I said I misunderstood this question as well.
Oh, no worries.
So
no worries.
Relatable. I think it goes back to what I've already said. We're not alone. Each of us struggles, and what may be a struggle for you, and this sounds like I'm being petty, and that's not my intent. Like if I break my fingernail and I feel that that's a traumatic event, that's traumatic for me. Where somebody else might feel like trauma is this big thing. Well, I went to war and you didn't go to war. I can't measure your emotions or your trauma or your feelings, because it's all about our past and how our conscious, and it's really our subconscious brain and our life experiences. And I would say embrace and love yourselves. Again, exactly where you are. There's no wrong emotion. There's no wrong feeling. There's no wrong situation. And we're all going to go through this life on our own path. And so I wanted to plug in, I do have free resources. I am a coach on the outside, and we have some blogs and she's going to include that in there, but it's on Legendary Phoenix. And on Legendary Phoenix, there's some blogs and guides. So you'll notice I didn't mention a lot of books. And the reason I didn't mention a lot of books is because our team has taken, I don't know how many books, tons of books, and we have collaborated them to take the best parts, or what we felt were the best parts out of those books, to make a whole or to make a guide to help people heal and go through things so that they can be successful.
Awesome. Well, yes, we are all about the resources, and AFWO Speaks is about bringing resources and people with those type of that knowledge level to the forefront. So, as she said, I'm going to edit the post after this is done, include the link to the Legendary Phoenix, in addition to the quotes, the books that she recommended for us, along with anything else that I may find interesting. But I want to thank Shannon for coming on here today and taking time out of her busy schedule to really be with us. So my really remarks is that, it's the weekend, it's Friday, and if you know what, if you want to stay home, stay home. If you want to go out, go out. But just be around positive energy. Protect your peace. It is so important that you consume that, because you know what, you worked hard. No matter where you are, just like she said, be with yourself, love on yourself, embrace yourself. You matter. Air Force Wingman Outreach at gmail.com is where you can email us. And the Legendary Phoenix is also a resource as well. We'll include that in the post. Thank you, Shannon. Thank y'all. Have a good weekend, and we are out.
Thank you, Drea, for having me on.